Some patients find out they have diabetes by getting their eyes checked. That's a condition that could lead to blindness. Optometric physicians are using the fact that November is Diabetes National Awareness Month to remind everyone that eye exams could be the first line of detection for diabetes, because it's the only part of the body where blood vessels can be seen without having to look through the skin. When performing a diabetic exam, Dr. Ivan Lee checks the eyes to see how well they're seeing.
We check the front surface of the eyes to make sure that there is no diabetic signs in the front surface of the eye. But one of the main things, diabetes causes something called diabetic retinopathy. So we have to dilate the pupils. We open up the eyes, we put some dilating drops in the eyes, and it opens up the pupils so we can get a good look of the retina.
It can take years before patients show any signs of diabetes in their eyes, but once it's detected, it needs to be treated quickly, otherwise it could lead to blindness.
Sometimes systemic diabetes can lead to diabetic retinopathy, but it can take 20 years before you're showing any eye signs. But if diabetes is out of control, then it can happen very, very quickly.
When diabetes is detected, doctors focus on the patient's sugar levels.
The first thing that we like them to do is just control their sugar through, whether it's through diet or exercise, through medication. Okay, that's the best way of controlling your diabetes. If it's out of control and diabetic retinopathy forms, then there are treatments for the eye itself. There are laser procedures if it gets to that point. And there's also injections to the eyes to control inflammation inside the eye. And there are surgical procedures for very severe forms of diabetes or diabetic retinopathy.
Dr. Lee warns patients not to simply rely on eye exams to detect diabetes. He also recommends patients get a physical, as diabetes is a serious condition that, if unchecked, affects blood vessels throughout the body. It could affect end organs, lead to illness, even death. Reporting in Hamilton, Sibyl Morency, WZBN News.